And hello, it is Kathy Frey here from IMCO, from the International Integrated Maternity Healthcare Organisation. And welcome along to this week's webinar. And we have got with us this week, Dr. Julia Bartrop. Julia, say a big hello.
Hi, how are we?
We are good. And this topic this week is so incredibly important, is preconception care. And we do certainly know that, the more we study, the more science studies preconception health, the more we realize how incredibly important it is and the implications that it has for that baby in weeks and months and years ahead. So, 50% of pregnancies are not planned, but 50% are. So for those 50% that are particularly, preconception care is absolutely something that you should be looking into. And Julia is spoken here before. We've done a number of topics with her, and I've asked her particularly to do this topic. And so Julia always gives us a fantastic, comprehensive webinar. So we're looking forward to this. And just a little bit of housekeeping. If you are unfamiliar with our system here at IMCO, so we'd love to hear whereabouts in the world you are from. So if you go into the chat section, which is down the bottom of your screen, and let us know where you're from in the world and your role as a health professional, that would be great to hear. Or maybe you are a mum expecting a baby, or actually planning to expect a baby with better timing. And also down the bottom of your screen is where there's the Q&A button. So if you've got any questions for Dr. Julia throughout the webinar today, just type them in and we'll absolutely make sure that we get those covered off. And so Julia's going to take over the screen for a good solid half an hour, perhaps a little bit longer. And she's got a really great PowerPoint slide presentation that she's going to be going through with you today. So huge welcome, Julia.
Hello. Okay, so I'm going to share my screen. So this is probably more of a pathology lesson, as well as what we go over and what we need to look at in preconception care. So it is quite long, so bear with me. And yeah, look forward to answering your questions at the end. So
fantastic. I'll hand it over to you, Julia.
Let's go. Okay, so preconception care. So as you can see from the picture here, we've got the male, we've got the egg, the sperm. It takes two, and this is basically what I'm going to be reiterating over my whole entire presentation, is it does take two. So what's going on? So let's get into it. Okay, so basically an overview is preconception care can actually take between 4 to 12 months. So we do require 4 months of treatment minimum for both partners, and that is when we're seeing them for Chinese medicine is weekly appointments. The whole aim with preconception care is just like farming. We aim to prepare the soil prior to conception. So basically when we're talking about preparing the soil, is we're looking at improving the overall health and wellness and quality of the egg and the sperm, and also as well as everybody else's overall health and vitality, because if there's any issues going on there, then we need to improve that, which will therefore improve fertility. So it's like a farmer, before he plants his crops, he tills the soil, he aerates the soil, he fertilizes the soil, he waits a little bit, and then he plants his crops. So preconception care, if we think about it from that point of view, is pretty much the same. We are laying that foundation where we're tilling the soil, we're aerating the soil, we're fertilizing the soil. We're basically building everything up so that we're in the best health that we can be to actually conceive a really healthy baby, have a healthy pregnancy, and have healthy children further on into the future. So throughout this seminar, you'll hear me say it takes 2 to make a baby, and the onus is not just on women. So for thousands and thousands of years, the onus has been on women. Why are you not getting pregnant? Why are you having miscarriages? Why are you not fertile? However, it does take 2 to make a baby, and this is a really, really important take-home fact. Okay, so preconception care is required for both the male and the female. For females, when we're actually producing eggs, this actually starts 12 months in advance. So if people are coming in for treatment just 4 months to trying to conceive, then we've got eggs that we're working on that have started developing 9 months ago that we need to improve the quality of, as well as the egg that they might fire off that month. For males, it takes about 120 days to develop from a single cell into a fully fledged mature sperm. So this is why we say a minimum of 4 months, because we're actually then working with one whole cycle of the sperm, and then we've got three to 4 extra months to work on improving the egg quality as well further down the track. So one of the things that has come up in the last 5 years is the impact of stress. So stress is huge on reproduction. It impacts both male and female reproduction. And in Western society, this is a major factor because we're so highly stressed. We run around, we never switch off. We're not necessarily eating the best food. We're not necessarily drinking enough water. And because of the stress hormone actually pumps in adrenaline and cortisol into your body, and you're in that fight or flight mode, which actually inhibits the reproductive organs from enabling reproduction to occur. Because if you think back thousands of years ago, if you're running from a tiger, you've got the adrenal response going, you've got cortisol flooding your body, all of your blood, all of your energy is going out to get you away from danger, and your body actually shuts down digestion and reproduction. And this is basically what is happening in Western society all the time because we're in that constant state of stress. So why is preconception care so important? Basically, in the last 20 years, there's been a huge decline in fertility. So fertility statistics at the moment, 40% is due to female issues, 40% due to male issues. It should be 10% male and female, and 10% are due to unknown causes. So a lot of infertility or fertility issues at the moment is actually due to sperm. So in the last 30 years, sperm has actually dramatically declined from where it used to be, or where our grandfather's sperm was. And according to the World Health Organization now, 4% normal forms is now considered to be fertile. So if you have a think about that, if you go back to where our grandfathers were, if they had a sperm test, they would be at about 75% normal forms. And even when I started in pathology, looking under the microscope and people were going through IVF, 50% normal forms was a minimum to actually be able to do IVF. If you had anything less than 50% normal forms, you couldn't do IVF at all. And now the World Health Organization is saying 4% normal forms is considered fertile. So 50 years ago, 30 years ago, these men would be considered severely infertile. So this is what I just want you to get your head around. And this is why preconception care is so important, because we need to build up sperm, and we need to build up egg, and we need to ensure that they are good quality so that we can actually have a fertilization take place and have an embryo implant leading to a pregnancy. So preconception care in Chinese medicine. So it's a holistic approach. We treat the whole body. We're preparing the body, the mind, and the spirit. So our aim when they come in for preconception care is not just focusing on fertility. So yes, they're coming in for preconception care. They're coming in to prepare themselves to get ready to have a baby. But we also look at the body as a whole. So if they've got any other issues, so if they've got sleep issues, if they've got digestive issues, if they've got anxiety or insomnia, we're going to be treating all of that as well, because that's all saying that the body is not in the best state of being. So we're going to treat that to improve their overall health and wellness. And we're going to assess hormones, we're going to be looking at nutrition, we're going to be looking at structural issues, as well as any chronic health issues. So like I said, if they're in a state of stress, if they've got digestive issues, or if they've actually got immune disorders, so autoimmune disorders, or Crohn's or something like that, we'll also be addressing that as well as improving their overall health. So when we talk about preconception care, we go through a whole entire history. So we will, for women, we're going to go through periods like when they started, how regular they are, what contraception have they been on, how's their libido, how's their overall health. For men, we go into, do they get erections? Do they wake up with erections in the morning? Do they have a good libido? Are they horny? Can they get it up? How long can they get it up for? Now, I know this sounds really funny, but all of this knowledge is really, really important because it leads to a diagnosis in how they're functioning overall with their health. And then, as I said, it's really important to decrease stress because stress is one of the major causes of decreased fertility as people are in that fight or flight, which leads to that switch of hormones being turned off and reproduction getting put on the back burner. So yeah, stress is one of the #1 culprits of issues with conceiving. Okay, so females and preconception care. So again, as I just said, when they come in, we're going to ask about their whole entire history, the history of their periods. Are they regular? Are they irregular? How old were they when they first got their period? What's their blood like? How long do they bleed for? What's the flow like? Do they have clots? Do they have pain? If they've got period pain, if you're getting breast tension, if you're having mood swings, these are all abnormal. This should not be happening. This is all hormonal imbalances and imbalance in the body and disharmony. So we're going to be working on regulating periods. We're going to be working on making sure there's no pain, there's no mood swings, and bringing hormones and the body back into balance. So the other thing that I start with all my girls is getting them to BBT chart. So BBT charting is basal body temperature charting. So basically first thing in the morning, they'll wake up before they even get out of bed, they'll take their temperature. Now, the reason why I get them to do this is, one, it empowers them. It gets them to know about their cycle. It teaches them about their cycle, and they get to know more about their body as well and get in tune with their body by doing this. But it also gives me a huge wealth of information that I can use to treat their cycle with acupuncture, with lifestyle advice, and with herbs. So when we're BBT charting, I'm looking at the BBT, I'm looking at it to see, is it a get pregnant chart? Do we still need to do some more work? But I'm also using it to help me to prevent issues cropping up in pregnancy. So if a woman's BBT chart, she's charting really low with her body temperatures, I know that there is a precedence that she could have nausea in the first trimester. So I'm going to be working on building up her basal body temperature by getting her to have warming herbs. So warming herbs are like ginger, garlic, cinnamon, etc. And then I'm going to be wanting to see a rise in the temperature, or we'll use moxibustion, which is a herb which puts a lot of warmth and a lot of heat into the body. And I'm going to be putting my hand on her abdomen as well to make sure it's not cold, because a lot of women, by sitting on the ground, we actually soak cold into our pelvis, which goes into the uterus. And basically a embryo doesn't want to implant into a fridge. We want it to be nice and cozy and warm. So I'm always going to be checking the abdomen as well to make sure that it's nice and warm, and this can be reflected back into the BBT chart temperatures. Okay, so this is basically an example of a BBT chart that I will get my girls to fill out. So you can see that the temperature's up along the side and that you can see 2 phases. So in the period, we all know that we should have 2 phases, the follicular phase and the luteal phase. We want to actually be able to see where ovulation is so that we can time sex as well when it comes to fertility. But before they actually go into trying, I want to make sure that they've got a get pregnant chart. So this here is an example of a get pregnant chart. We've got the 2 different cycles. You can see that ovulation has happened clearly. You can see where the green is that she's had cervical mucus. Technically, she's only bled for 4 days. From Chinese medicine, I prefer her to have 5 days of bleeding, but that's okay. Her luteal phase is actually 15 days, which is really good. If we've got a short luteal phase of 12 days, then I'm going to be focusing with the preconception care in lengthening that luteal phase, because we do want about a minimum of 12 days, but we prefer a 14, 15 day cycle. If the follicular phase is too short, then we haven't got enough time for that egg to actually develop and mature, and we get a lot of small eggs and they're not likely to be fertilized. So this is the importance of BBT. And then you can see with the temperature, so her temperature in the follicular phase is like 36.1 to 36.2, which is good. I want the temperatures to be between 35.9 to 36.4, and then in ovulation about 36.4 to 36.7. And you want to see that definite rise, and you want to see that rise staying there. Okay, if you get a rise and then it's falling really quickly, you know that there's imbalances within the hormones. So this is why BBT charting is so important, because it gives me so much knowledge, and it also helps me to address her individual issues, to improve the quality of the eggs, to improve her cycle, and also how I'm going to treat her, whether I'm going to be building up blood, whether we're going to be focusing on decreasing exercise or increasing exercise, or whether I need to give her warming herbs or moving herbs, and also what she needs to do within that month. So,
Julia?
Yeah?
Can I just interrupt? And could you just repeat again those specific temperatures?
So in Celsius, I want, in the follicular phase, I want a minimum of 35.9. So 35.9 is the lowest that I will accept. If it's less, we need to bring it up to about 36.4. And then in the luteal phase, you want to see a rise of about 0.5 of a degree. And you want to, if they've been under 36.4, you want to see 36.4 to 36.7. So, and then if temperatures are too high, you actually need to bring them down, because if they're too high, there's too much heat and an embryo won't actually, it's not good for the embryo. So, yeah.
Awesome. Thank you.
Okay. So female blood test. So this is actually part of the preconception care when they come in. So if there's no history of miscarriage and there's regular periods, the female hormone panel. Now, this is really, really important. And all of my girls and all of my guys that come in on the first appointment, I send them off for these tests. I want a day 2, day 3 follicular FSH, which is follicular stimulating hormone, done. And it's really important that it's done on day 2 or day 3. We then want the rest of the hormones. So you'll then get estradiol, prolactin. You want a day 21 progesterone if they've got a 28-day cycle, or if they have a longer cycle, then 7 days after ovulation. So you want them to be able to know where they ovulate so that you can actually get this done 7 days afterwards. If they've got really irregular periods, I'll just send them off and get a basic panel done, not worry about the 21-day, 7-day progesterone. I just need a basis of where their hormones are, and then I'll start them BBT charting. And once we've got a couple of cycles and we can predict where ovulation is, I'll then get the progesterone done. So we also want to know the estrogen, the luteinizing hormone, and the sex hormone binding globulin, and as well as testosterone. So testosterone is really important in females because it can also tell us whether she may have PCO, polycystic ovaries, or polycystic ovarian syndrome. So for PCOS, you will have greater than 40 follicles on each ovary. If it's polycystic ovaries, there'll be lots of follicles, but less than 40 on the actual ovaries. So I also want to be getting thyroid function tests, iron studies, vitamin D, a full blood count, ESR, UNE, and LFTs. And if possible, it's not always possible, but an internal ultrasound, just to make sure that everything's there, so that the uterus is fine, there's nothing wrong with the ovaries, the tubes are clear. And then that just lets them know, and myself know, that we've investigated that, there's no issues, we're good to go, and proceed with the preconception care, knowing that there's no other issues that we need to deal with. Okay, so why do I do this? It's a holistic approach. We're treating the whole body. The blood tests provide us with knowledge. They're a marker. So I'll get them to do it as soon as they come in, and then in 4 months' time, we'll redo them, and we're looking to see improvement. So with the internal ultrasound, as I said, we want to see that the uterus is clear, the tubes are clear, the ovaries are clear, rule out PCO, PCOS, any blockages, or any endometriosis. Now, women that are coming in with low vitamin D, iron, and thyroid issues, this all affects fertility and can have a huge impact on pregnancy as well. We want these levels up, and we want her to be in the best health to conceive. So women that are coming in with a vitamin D of 50, their immune system's generally low, they're really tired, really fatigued. You'll quite often find that they've got low mood. As soon as we get those vitamin D levels up, and I like them to be at 120 and stay at 120 all through pregnancy as well, you'll find that fatigue improves, mood improves, and their immune system actually becomes a lot more robust. Now, iron is really, really important, because if her iron levels are too low, she's not going to be able to conceive, and she's not going to be able to hold a pregnancy either. So I've got many women coming in that are borderline with their ferritin levels, like on 30, and I'm like, you're needing an iron transfusion. No wonder, you know, you're so tired. No wonder you're so fatigued. And the issue is, if the iron's really low, and they're anemic, they're not producing enough blood. They're not having a lining which is thick enough to actually have an embryo implant. So this is why I'm looking at these and why I'm looking to build them up. It's all part of that preconception care. And thyroid also has a big impact on fertility. So if they've got issues with the thyroid, so it's working overtime, or it's working under time, or we've got antibodies, this also affects fertility. So we want to make sure that all of these are functioning correctly, so that we can address that with the preconception care as well. If someone comes in and they do have like Graves' disease, or you know, issues with the thyroid, we're always going to be working on that, and most of them will have endocrinologists or be under specialist care anyway. So I just work alongside those specialists and just make sure that we're improving the functioning in hand with those specialists. And then again, we're doing the BBT charting daily. And I will ask for that every week. I want to see what's going on and how they're going and what's happening. So because this just helps me to reinforce the treatment plan and what we're doing. Tilling the soil for her. So it takes a minimum of 3 months to actually improve egg quality and to help to regulate the cycle. So this is also why we recommend a minimum of 4 months of preconception care prior to conceiving. For some women or some couples, depending on what's going on, preconception care could be from 4 months to 12 months, depending on what we're working with and where we're starting. So when we refer to tilling the soil, we're improving egg quality, we're regulating the cycle, we're addressing any hormone imbalances, we're addressing stress. If she's got period pain, we're going to be addressing period pain, because that's actually a sign that the body's not in harmony and that there's stagnation in that uterus, so we need to clear that out. We're going to be focusing on building up energy, focusing on building up blood, because your periods and your uterine lining, we need a minimum of 8 mil in that lining to actually hold an embryo. So anything less than 8 mil on an ultrasound around, you know, ovulation, and we need to build that up. So again, stress, we're going to be looking at stress. Everyone that comes in gets Shen calming points and calming down points, and they get homework with the seeds. We'll also address diet and lifestyle advice. So some women might need to lose weight, some women might need to gain weight, some women might need to decrease exercise, some women might need to increase exercise, some women might need to cut down on junk food, others need to build up their fresh fruit and veggies. This is really important, and it's really important that women that come in and they've got that flat washboard stomach actually have a little bit of weight behind them, because we actually need to have a little patch of fat over our ovaries, because this fat actually nourishes the ovaries and gives them that energy to actually flick that egg out from the ovary into the fallopian tube and cause ovulation to occur. So I've had some women that come in and we're like, look, you need to put on 3 to 4 kilos. You know, and this will help with your cycle and help make you more fertile. Like, no. And then later on, they're like, yes, okay, I'll put on weight. As soon as they start putting on the weight, we start noticing that their periods, if they've had irregular periods, become more regular. If they haven't had a period, they actually start having a period. And I did have one lady who went to an endocrinologist and she was told she had to go to IVF. She did IVF for two pregnancies, and then I said to her, you need to put on weight. She put on weight, and she's now conceived naturally with two natural pregnancies, not having to go to IVF with just putting on 5 kilos. So this is where the preconception care comes in. It's really important because we're looking at all the little things to actually enhance chances of conceiving and improving their overall body as well. So just putting on that weight actually enabled her natural body hormones and endocrine system to kick in and actually start functioning correctly. So the other thing is we want them all to be having a prenatal multi. So we don't want folic acid in our multivitamins. You need to make sure that the multivitamin contains folinic acid, because a lot of people can't actually absorb the synthetic folic acid. And folinic acid is now the new recommendation. If you are taking a multivitamin with folate in it, folic acid in it, please stop and make sure that you talk to someone and find one that has folinic acid in it. Because for those people that can't actually absorb the synthetic folic acid, it just builds up in their body and becomes really, really toxic. So preconception care and men, right? I am going to start with, we need a sperm test. Men need to be tested. Men are not tested. You know, I get women coming in for preconception care and they bring in files and they're like this big, and I'm like, where's your partners? You know, where's the sperm test? Where's his male hormone panel? What investigations have been done? And they sit there and they look at me and they go, huh? And it's like, this is where it takes two. If you're coming in for preconception care, it's both of you. We can work on one, but, you know, it's really important that we focus on both of them and that we focus on men as well, because, you know, 40% of fertility issues are due to men and due to sperm issues. So male sperm, as I said, has declined in the last 40 years. They're now considered fertile with 4% normal forms. So if you think about that, if I've got a bunch of grapes, I've got 100 grapes in my hand, 4 are normal. 4 I can eat, the other 96 I have to throw in the bin. So just have a think about that. You can't conceive naturally on 4% normal forms. We need a minimum of 15% normal forms to actually conceive naturally, which is why a lot more couples are having to go to IVF. And even then, with 4% normal forms, I'm like, IVF is not necessarily going to work for you. You're better off doing your 4 months of preconception care, bringing your sperm up, improving your egg quality, and you will actually get much better results if you are going to IVF. Those people that come and see me for preconception care where they're unknown, we work on building up overall wellness, and a lot of them on their first go with IVF have actually got pregnant successfully. So there are many issues with IVF and natural conception due to sperm. It's not just the female. Don't just focus on the female. The male is really, really important too. And yeah, as you can see in my words, always, always, always investigate the male too. Okay, so the morphology of sperm. So if you have a look over here, you can see where it says normal. You've got 2 sperm that are normal. So they've got a nice oval head. You can see a good thick middle body and a tail. So if we have a look at the abnormal forms, we've got small heads, we've got pointed heads, we've got double tails, we've got double middles, we've got double heads. So when we're having a look at our normal forms, this is what a normal sperm should be doing. And a normal sperm should be swimming forwards and should be swimming fast. So when I used to look down the microscope, we'd have sperm, and the ones that are good are going, woo! And then we'd have other ones that are like, you know, this, and then we'd have other ones that we call the fishes, and they're not the good ones. And then you'd have other ones going, wee, swimming in circles. If your sperm's swimming in circles, if they're just meh, you're not going to get them up to the egg. We need to have good sperm morphology. We need to have good motility. So you want those ones that are swimming forward and swimming fast. We want them to be, you know, we want a good concentration as well, and we want to be able to get the sperm up there ready to fertilize the egg. So as I said, 4% normal forms. So you've got 4 out of every 100 that are normal. You haven't got the concentration that's going to get up there to actually fertilize an egg, which is why with males, with preconception care, a lot of it for me is focusing on improving sperm function, sperm morphology, sperm motility, and sperm progression. So that's that movement forward and swimming. So just what a sperm looks like under the microscope, because I used to do this previously. So you've got that acrosome at the top, and you want that to be an oval, because this is the one that it pecks in to actually get into the egg. And this is where the DNA is. You want that mid piece to be thick, and you want it to be a good size, because this is where all the mitochondria are, and this is what gives the sperm the energy to actually swim up to the egg. And then you want it to have a good tail as well. So sperm test, it's really important that you know the motility and the morphology. Now, I know in New Zealand and in the UK, they don't do morphology as part of their normal test. You will only get the concentration, volume, and motility, but that will still give you enough information on how you can improve the men's sperm. Okay, so volume, you want them to actually be able to put a minimum of 5 ml in the cup for testing, and the concentration needs to be about 30 ml per million, so that we've got enough sperm in there to actually get up and fertilize an egg. So preconception care for men, we are focusing on improving sperm quality, quantity, motility, and normal forms. The normal forms mean that they have the normal head and tail. We don't want to see the abnormal forms with the multiple heads, the multiple bodies, etc. So again, stress greatly impacts the production of sperm. So we're going to be focusing on making sure that they're not stressed. So giving them activities to help decrease stress. So breathing exercises, they're not exercising, getting them to do 30 minutes of exercise a day, looking at their nutrition. How much caffeine are they taking? How much of the energy drinks are they taking? What's their fruit and veggie intake? What's their water intake? So many guys come in and it's like, well, what's your water? You know, we need at least 2 liters of water a day, and they're like looking at me going, well, maybe a glass. So we'd start there. With men, keep it simple, keep it firm instructions. So right, this week we're improving water. I want you to have 3 glasses of water a day. Keep it short and sweet. Men don't like to be told that their sperm's crap, that, you know, they're the reason that they might not be able to conceive. So we always pick something. If they're coming in and they've got sleep issues, it's like, right, let's fix your sleep. As soon as you fix something with the male, they're on board. They're going to be even more on board, and they're going to start responding even better to treatment. So yeah, if it's weight loss, then it's like, right, let's focus on losing some weight, and we're going to focus on decreasing stress at the same time. We want to make sure that our men are taking a multivitamin as well, and the male multivitamin needs to have a minimum of vitamin C, zinc, selenium, magnesium, and vitamin E. Now, these nutrients are so important for sperm production, sperm motility, sperm morphology, and also improving overall sperm health as well. So blood tests that I want for the males includes the male hormone panel, so specifically testosterone, and you want free testosterone within that as well, prolactin, estrogen, luteinizing hormone. So again, set as exactly the same as women, we want to be looking at thyroid, iron studies, and vitamin D. Because again, this all leads to issues with reproduction and fertility. So similar with women, I want them up at 120. I want to make sure iron's all good, because if the iron's not good in men, it's telling me that there's a digestive issue going on. We need to focus on that to improve overall health, to improve hormones, and to improve nutrients. So these are basic tests. If there are any issues with the testosterone, etc., they may need to go and see an endocrinologist. Thyroid issues do affect fertility. So again, in males, we'll always be treating that as well. And if there's a high degree of abnormal forms in the sperm, you may need to do a DNA fragmentation test and feather testing as well. But that's later on down the track, and that's something that we'll get into in the infertility talk. So with men and traditional Chinese medicine, so it takes 4 months to develop from a single sperm into a fully fledged sperm. During that time, we are always going to be focusing on improving the motility, the morphology, the concentration, improving the normal forms. But again, looking at overall health. So focusing on stress. Do they need more sleep? How is their sleep? Do they need to lose weight? Do they need to exercise more? You know, do we need to improve their water intake? How much caffeine are they drinking? You know, some guys come in and they're like on 8 coffees a day, but no water, which means they're extremely dehydrated, which is going to decrease their concentration of sperm. So we want men to stop drinking alcohol as soon as it's decided that they want to try and conceive. They want to, you know, start a family. We also need them to decrease their caffeine intake, because alcohol and caffeine actually do affect sperm production and concentration as well. So supplements, so we need them to be on a male preconception supplement, and then included in nutrition, I might actually get them having the male fertility smoothies as well, which increases their increase of natural fatty acids, then their natural fats in the diet. So it's really important that we have fat in our diet, because we need fat for hormone production. I'll get them to put in a handful of walnuts, a banana, some maca, and some cacao, because they're all high in selenium. That all of that together is actually high in selenium, vitamin C, magnesium, manganese, and vitamin E and zinc as well. So we want to address any fatigue and any libido issues. That's really, really important. And also, if they're cycling, we want them to cut down. Tight shorts and heat kills sperm. So if they are avid cyclists and they've been doing it 7 days, I generally ask them to try and cut it down to 3 days. Or if they won't do that, then we try and cut down their cycling times. So I always work with my client, because, you know, we don't, if it's helping with stress and it's something that they love, we don't want to just take it away. So we're always working hand in hand with the client as well. So again, with the intake, we go through everything. So their overall health and wellness, their libido, any medical issues, any medical conditions, you know, how much exercise are they doing, how's their sleep, how's their water intake, you know, do they wake up with an erection in the morning, how long can they hold an erection for, because this all gives us more information about how their overall health is. And then advice on diet and lifestyle. So most of the guys come in and they'll be drinking, especially the young ones, they're drinking a lot of caffeine, they're drinking a lot of those mother energy drinks. A lot of them, if they're tradies, will be eating pies for lunch. So we want to try and increase fruit and veggies within their diet to increase the natural antioxidants and water as well. So we'll give them the treatment plan. We say, look, this is what's going on. This is what's affecting everything, and this is the plan for the next 4 months. So I'll send them off, get a sperm test, and then say in 4 months' time, you know, we'll run through the sperm test as well and say in 4 months' time, we're going to retest and we're going to check what the improvement is. So with sperm, it's really important that you do get the test, because it shows us the overall health of a male from a TCM perspective. So if you've got 4% normal forms or less, you know that overall their reproductive health is not in good condition. You know that there's a lot of issues you need to work with, a lot of improvement that can be done. And males actually respond really quickly. Like I've had one guy that came in with 2% normal forms, and after 4 months of treatment, he got on board and we actually improved it to 12% normal forms within 12 months. And the look on his face when he saw that was just like, oh my God. It can be done. And guys are like, you sure you can improve it? It's like, yeah, if you work with me and we do this, you can have major improvement. And they actually went on to have a natural conception first try once I told them they could start, which is really good. So it takes 2 Western society is still really, really patriarchal. The focus is on the female. They'll come in, lots of files, lots of tests, but there's nothing about the male. So I just want to reiterate that preconception care is about both of them. And please, please, please investigate the hormones. Please investigate the sperm, because this is you know, the basis of a baby and the health and wellness of that baby and that child. So we want to get them in the best condition that they can be to make the healthiest embryo, to make the healthiest you know, fetus, which then goes on to be a healthy child. So again, we're going to be addressing sleep, stress, overall health and wellness. Both couples need to stop drinking alcohol 6 months prior to trying to conceive. And this is because alcohol actually drains the body of the zinc, selenium, magnesium, vitamin C, vitamin E. It drains the body of so many nutrients, and this actually affects sperm production as well. It also causes heat in the body, which can have an adverse effect if we're trying to decrease body temperatures and increase water consumption. So overall, preconception care is talking about overall health, improving overall health and their vitality. And from a TCM focus, we're focusing on the whole body, not just on preconception care and fertility. So treatment, after this, you'll be able to get my blog, 5 Ways to Improve Your Fertility, which actually has the list of blood tests in it, increasing exercise, decreasing alcohol. Explain to people that, you know, it's a minimum of 4 months to prepare the soil. So we're improving egg and sperm quality. We're improving overall health. We're focusing on diet and exercise, increasing water, caffeine, no instant coffee. We'll allow them 1 good coffee a day if absolutely necessary. If they require more, then that's something that we need to investigate. Why do they need that coffee to keep them going? Why haven't they got that energy to be able to go through the day without needing a caffeine fix? Exercise is really important. We want both partners to be doing it at least 30 minutes a day. That doesn't have to be all in a row. It can be broken into 10 different minutes. It can be walking, it can be yoga. We don't mind. You just need to be moving your body. The overall picture is that we're improving mental and physical wellness while we are doing the preconception care as well. So in summary, it takes 2 preconception cares, a minimum of 4 months. It may require a year. It's dependent on the individual. We're going to focus on decreasing stress. I know I've said that so much. Diet is really important. So we want them to be increasing fresh fruit and veggies and water, good low GI carbs, and we want them to be eating fat. Fat is so important because we need it for hormone production. We want to be seeing a sperm test, and we want the female to be BBT charting. And basically, overall, preconception care is based on the individual, based on what they need. Acupuncture and Chinese medicine can greatly improve the overall health and wellness of the person, thereby improving fertility and reproduction. Yeah, so that's my talk for today. Hope I haven't gone too long. I look forward to answering your questions. I know it's a lot to take in. Not so much on acupuncture and points, but more just on the holistic care of what preconception care is today.
Oh, that's so fantastic. And Julia, you always on these webinars manage to fit in so much information. We're very grateful. One of the questions that's come through is now there are theories around women taking folic acid causing tongue tie. I'm not aware of any really good research on that, but I am aware of very strong rumours on that. And so the question has come in, what's the thinking of folic acid versus folinic acid on that? So is there any change to how that may impact the rates of increases of tongue ties?
Yeah, so the folinic acid basically is a methylization, is a methylated form of the synthetic folic acid. So there has been a lot of research saying that the folic acid is causing tongue ties. There are an increased incidence of tongue ties and everything. There's not enough studies to say that the folinic acid is preventing that. However, the new research does state that in the prenatal vitamins, you have to have the folinic acid now rather than the folic acid. And this is also because there are women and men out there which have an MTHFR gene. And if they've got that gene, they can't actually break down that folic acid. And that's what I said, that if they can't break it down because they don't have enough methylation, the methylation pathway can't actually be accessed. And then that excess folic acid keeps going round and round in the body, forming toxicity, which is a theory that this is what is actually causing those tongue ties, those lip ties, etc. So,
yeah, because for those who are sort of unaware of how that all correlates, the purpose, the folic acid or folinic acid is all there to basically keep everything in the center of the body together.
Yeah.
Right. And it's to do with a very early stage within embryology where the body's the embryo sort of folds in upon itself, and as it should. And you know, the little filter and scar that we have above our lip, that's a scar of the body folding in on itself as it should. And so it's almost like a theory that it overfolds, it does a too big a job, and that's where we get left with a tongue tie baby. So that's sort of oversimplifying it. But so really the answer there is that because the folinic acid is more absorbable or processable by the body, the folic acid, then in theory it should make a difference because it's not floating around creating that level of toxicity, right?
The folic acid is a methylated form of the folic acid, and then because that's the methylated form, it's more easily absorbable. So so if you are worried about it, just check your woman's prenatal multivitamin and the male prenatal vitamin as well, because I did have one guy who was coming in who had folic acid in his multivitamin, and he was an MTHFR positive, and I'm like, this is not good for you. So this is why preconception care is so important, because if you're picking up little bits of things, we can improve the overall health before we can actually lead to any issues further down the track.
And from your point of view, are you seeing more of the general supplement manufacturers picking up on this, or do you think they're just far too slow? Or what's your thoughts of the whole folic acid versus folinic acid?
So I think it's been too slow. There was one that I used when I first started, and they actually stopped production of their multivitamin. It's now just come out, and that's got the folinic acid in it. I know that a lot of the manufacturers have been put on notice that within the next 2 years they have to take the folic acid out, but a lot of them are still just producing their normal recipe. So I do carry a range of natural multivitamins that have been made by a naturopath that has really low excipients and has the folinic acid in it. So I'm I will get people to bring in what they're taking, and I will go through it. And I will say yes, I will say no, bin it. So it's not even worth continuing with the jar, just get rid of it. So
all right. Now we've got a question asking if you could repeat the treatment for increasing sperm count. Everybody watching this webinar will be receiving a link in 24 hours from now, a automated message from Zoom that will give you a link to be able to re-watch this webinar video. So because that was I don't think that's a quick answer. You know, it's just not a quick question to answer, so that's probably the best thing, is to be able to go back in and watch that particular slide so you can see, because there was quite a few things that you covered off to do with increasing that sperm count. And
just in
we've got
regards
a
to
question.
that, with increasing sperm count and sperm morphology, you might, this is why I said preconception care can be 4 months to 12 months, because you may require a couple of cycles to actually get that sperm, that morphology, that motility improved. And it depends with how on board they are with you. If they're fighting you for the first half a year, you know, if they're not on board, then, you know, you're basically pushing a boulder uphill. If they're on board from the start, I generally get much quicker results. But again, to improve sperm morphology, motility, working on the sperm, no alcohol, absolutely no alcohol. Caffeine, you know, if they absolutely must, 1 good coffee a day. You want to make sure that they're drinking at least 3 litres of water a day, and none of those energy drinks, etc. They all have to go. If at night they cannot wear undies to bed, they can free ball it. That would be really good as well. Bamboo underwear, you know, it takes the heat away. If they're cyclists, get them to reduce cycling. So, because with cycling, you know, their balls and everything are up, they're squashed, they're in lycra, there's a lot of heat going on. Basically, they're cooking their sperm. So this is why we say, please try and, you know, decrease cycling. So that's just a very quick answer. But
it makes me giggle because with women, you know, completely separate topic, is we don't want them to have a super strong pelvic floor when it comes to birth. And we often say to those women who are horse riders or Pilates addicts, you need to dial that down for birth. So here we are with the men, and the equivalent is the cycling. And I think a lot of them have probably got no idea that it's causing any issue whatsoever. But when you think about it, of course it will be. So with regard, now of course we've got people who are watching this live today, and people who have registered for this webinar and will be watching it later, but further down the track we have people who will be watching it who have never registered for the webinar. So for those who are interested to get hold of a copy of the PowerPoint, you've got your do you want to just go over your contact details as well?
Oh, I didn't put my email in, sorry. You can email me at rebalancetcm@gmail.com, and I'll be happy to send out a PowerPoint to you. You can hop on my website. So the blog is there, 5 ways to improve your fertility. And I've also written a blog, the A to Z of the sperm test. So this is all my knowledge from pathology. So it runs through the motility, it runs through the morphology. Use it as a Bible. So basically, that one will come really in handy. Yeah.
Love it. I really think that your introduction at the beginning, when you're talking about, you know, tilling or preparing the soil, that just is such a good analogy, because, you know, we all know that if we want to go and create a veggie garden, the first thing we have to do before we start investing in buying seeds is we need to prepare the soil. We know that. You're not going to go out and buy a whole lot of, well, probably not, but, you know, buy a whole lot of seedlings or seeds and put it in there for your veggie garden and have given the soil nothing. Yeah. We wouldn't do that for a lettuce, yet we're doing that for our own babies. So it is kind of a really, I think, a powerful analogy that you mentioned there. Also, I think that we hear a lot about, you know, the fight and flight and fright kind of situations pausing digestion. You know, I think a lot of people are aware that that's one of those things that happens, that your body will prioritize and not be digesting when it's in that flight, fright, and fight mode, but we forget, and it's not often so much spoken about, that the same thing happens with reproduction, that of course your body's going to put that basically sort of on pause and make it a deprioritize it within the body system. So of course, if we're stressed, we're not digesting properly, and we're not going to be able to, our body's not focusing on reproduction. So it's good to sort of add that one in there as a reminder. It's not just digestion that pauses. Amazing that, you know, really the male infertility rates are pretty much identical to the female infertility rates. And, you know, that's but I guess the big advantage with men in a way is the fact that it's so easy to be able to visually look at the health of their sperm. It's not easy to visually look at the health of women's eggs. And, you know, what you're seeing under a microscope is such a barometer of that male's health, isn't it?
Yep. Exactly. Yeah. So, and the fact for men is because it only takes 120 days to, you know, form from a single cell to a fully fledged mature sperm, you know, we can see the results of working with men and their health a lot quicker as well. And I think that really reinforces to the guys, oh, you know, it is working. I am getting healthier, because they can see an improvement. Even if we see just a slight improvement in 4 months, I still focus on that, because that is a big thing. So, and
they must, surely, the side effect of their sperm becoming healthier is they must feel better.
They feel better. Like a lot of the guys will come in, they're like, what are you doing to me? I'm more relaxed, or I'm sleeping so much better, or I've got so much more energy, or, you know, my digestion's so much better, or, you know, I'm not so hungry anymore. What'd you do to me? So
I love it.
That just balancing out the body and getting the body working at its optimal level. So, yeah.
Well, we are going to have to wind this up. And for those of you, I'm just thinking now that because we're talking of the topic of preconception, it is very possible that people may be watching you, Julia, for the very first time, whereas you've actually been one of our regulars here, because we've had so many different specific little topics that are actually really big topics that we've got you to focus on, which has just been so good. And we're sort of ending up where you and I, we're sort of deciding that we're almost creating like a mini series out of your particular topics, because the coverage has been so great. But and we are running out of time, but I'm so sorry. I've realized we really failed to do a proper introduction to everybody today about who you are, and that was really slack on my part. I'm just assuming everybody knows who you are because you've been here before. And for those of you who don't realize, Julia is one of our volunteers here at IMCO. She's a very important person within our team, incredibly valued. And yeah, so please, while we're just towards the end, please give an overview. Sorry, it's a little back to front today, but do explain to everybody your background as well.
So I'm Dr. Julia Bartrop. I am a acupuncturist and Chinese herbal medicine practitioner. So my passion is women's health, and I do treat preconception care, fertility, pregnancy, all the way through to postnatal care, treating teenagers with, you know, their period issues. I'm a mum of 2, so I have 2 little girls, 18 months apart, so they're 5 and 4. But my first background is actually in pathology, so I have a Bachelor of Science in Medical Science. So this is where I actually married together the Eastern and the Western to make a really holistic treatment for all of my clients. And this is where I use all of my knowledge. It just comes in. And yeah, this is also where I've looked at sperm down the microscope. So I know what I'm looking for. So.
That's right. Yeah, exactly. And you know, and having that medical science background in pathology, which of course is disease, and combining that with that health wellness practice within Chinese medical herbalism and acupuncture. I mean, it's just such a perfect combination. And let's face it, you know, you and what you're doing, you are absolutely the epitome of integrative medicine. That you're taking that medical scientific mainstream knowledge of today, combining it with the ancient practices of Chinese medical herbalism and acupuncture, and you know, so you're exactly where we all want our healthcare to be progressing towards. But look, that's everything for today. And Julia, is there, before we wind up, is there anything that you would like to add in or close with?
Just like I said, it takes two. Please just focus on both. So because you can't have one without the other. So, and stress, as I reiterated, just get everyone to de-stress, which,
right,
you know, in this world at the moment is a little bit difficult, but, you know, just focus on gratitude as well, and just focus on, you know, finding joy in something in their day, and that will just help to bring out feel-good hormones and decrease those stress hormones.
That's beautiful. Thank you so much, Julia, and thank you to all of you who are live here today with us. That's always fantastic. It's great to get questions, and that's wonderful. We wish you all a wonderful rest of your week, and hope to see you perhaps next week at the following webinar. So thank you, everybody, and thank you, Julia. Bye.
Bye.